Hi everyone, welcome back. This is Mary, and today I am excited to share with you some of my study strategies that I use to learn the burn injuries as well as its classification. And today we're just going to go over the classification because as you can see on the whiteboard behind me, there's still a lot of content to cover. So we're going to break up the material by doing just the classification today, and I'll cover the intervention at a later time. So go on my website. Under the forums, you'll see supplemental YouTube video notes. I want to encourage you to print out this image so that you could take notes while you follow along, because I think that might help you learn and retain the content better. Okay? Now, before we get started, I just want to mention that depending on the exam prep material you're using or the sources that you're referencing, you will see different numbers, particularly when it comes to healing time. And this was a point of great frustration for me because I wanted black and white answers. I wanted that clear-cut approach, and rightly so, right? You need to get that best answer, the correct answer on the exam. But what I later discovered and learned was that that's not really what's most important, whether it's 2 weeks or 2.5 weeks. What's important is for you to get the whole clinical picture for each burn classification. So understanding the potential for scarring or functional impairment, understanding the depth of the burn that is involved with each classification, and understanding how the injury presents itself clinically, and factoring that in with the healing time. Understanding all of those components is what's going to allow you to make a clinical judgment about the intervention that is most safe and appropriate for the client. So I want to encourage you not to have that parochial view, not to get stuck on one little thing, but to really conceptualize the content and to understand it broadly. Now, the source that I'm using for your reference is the Pedretti's textbook. And if you've been following me on my journey and watching my videos, you know that I go to the Pedretti's textbook for just about everything, and I use it as the final source. But that's not to say that that's the only book that I use. In fact, I cross-reference everything that I go over with multiple sources because I think accuracy and reliability is of the utmost importance. And for this video, I actually cross-referenced it with this textbook, Rehabilitation of the Hand and Upper Extremity. It comes in 2 volumes. It's one of my favorite books. If you're going into hand therapy, this book is a must. I'm not in hand therapy and I still have it. That's how good it is. I'll put it in the video description if you guys are interested. In terms of the way that the burn classifications are broken down, you'll see here that I've written 2 different versions, and that's because traditionally the burn classifications were referred to as 1st degree, 2nd degree, 3rd degree, and so on and so forth. Now they're referred to as superficial, partial thickness, full thickness, and subdermal burns. And there are more classifications than this. I'm just going to go over the 4 because that's what I study. That's what you need to understand. But I decided to include both of those classifications because you'll still hear both of them being used interchangeably in the clinical setting. Okay? All right, so let's start with the superficial burn. Now, with burn wounds, it's important to understand that it is classified according to the depth of the skin layer involved. That means you'll need to know basic skin anatomy. So in each box, you'll see in the upper left-hand corner, I have a green box, and that is a very, very rudimentary sketch of a cross-section of a skin. That's to show you where the epidermis and dermis and the subcutaneous tissues lie. So at the very top, outermost layer lies the epidermis, and below that is a thicker layer called the dermis, and the final, the deepest there is the subcutaneous tissue. So epidermis, dermis, and the subcutaneous tissue. With a superficial 1st degree burn, the layer of the skin involved is just the upper layers of the epidermis. And so you'll see that I highlighted that in blue. And to remember this one, you just have to, the clue is in the name of the word superficial, because superficial by definition means occurring or existing at or on the surface. So outer layer, the most outer layer, right? And the most commonly associated superficial first-degree burn is a sunburn. Okay, so think back to a time when you had a sunburn and what that looked like and what that felt like and how long it took to heal. Mild discomfort, hardly excruciating. You'll probably have minimal or moderate pain level. And what will you see? It'll be dry. You'll see some redness. You may see some peeling, but no blisters at this point. And how long would it usually take for a sunburn to heal? Less than a week, right? So I put 3 to 7 days. And healing time, you guys, is correlated when we're talking about burn injury to a likelihood of developing a hypertrophic scar, contracture, or a functional impairment. So generally speaking, when a burn wound takes 21 days or longer for it to heal, the chances that you'll have scarring and functional impairment is high. So with a superficial burn, first-degree burn, where you're just involving the upper layer of the epidermis and where you have only 3 to 7 days of healing time, your risk of getting a hypertrophic scar or contracture is none. It's a 0, okay? And that's indicated with a thermometer here, or what looks like a thermometer. The higher is colored in, that indicates higher likelihood of scarring. Okay, and I also put a coffee cup there in the diagram or in the box because coffee or hot liquid, brief contact with hot liquid like tea or coffee can also give you a superficial burn. Now, with all of these classifications, there will be overlap in the mechanism of the burn. So it's not only in the superficial burn that you'll see a sunburn. You may see a severe sunburn in the second-degree burn. The reason I use these examples is to give you an idea of a visualization of what kind of mechanism of burn would cause a depth of injury at that classification. Okay, so let's move on to a partial thickness burn. This is a second-degree burn. And for this one, it is further subdivided into 2 subcategories, which are the superficial partial thickness and the deep partial thickness. To understand a second-degree partial thickness burn, you need to know that the word partial is actually referring to the dermis. So again, the clue is in the word. And although it's not called the dermis burn, I sometimes in my own head like to think of the second-degree burn as a partial dermis burn because that partial is referring to the fact that part of the dermis is now involved in addition to the epidermis. Let's talk about each of these 2 subcategories separately. So first one, the superficial partial thickness burn is when you have the epidermis as well as about 1/3 of the dermis involved. So it's not going too deep into the dermis, but its partial dermis is now being affected. So that's the burn depth. In terms of the type of, the cause of this type of burn, I have a curling iron here drawn. So it's any contact with something like hot metal. So this is more serious than what you might get with a sunburn. You could have, like I mentioned, a severe sunburn or prolonged contact with hot liquid and get that second-degree superficial partial thickness burn. But to really help me visualize and understand this one in the clinical presentation, I like to remember this one with a hot metal. So think of a time, if you're a woman or a man, when you were curling your hair and you got that burn in the back of your neck because something got stuck. What will you see here in this case? You'll see redness. Instead of being dry, now you'll see blisters, so red, wet blisters. And what is the pain level like when you get hot metal in direct contact with your skin? Significantly painful, right? So we're not talking just peeling and mild discomfort. By the time you're at a superficial partial thickness burn with 1/3 of your dermis involved, the pain will be pretty significant. Despite the significance of its pain, however, the risk for scarring is still very low at this burn depth, and the healing time won't take too long, less than 2 weeks. Some sources say 1 to 3 weeks, but Pedretti source is less than 2 weeks. So just understand again the general time frame. And the risk for a hypertrophic scar is very low. So that's a superficial partial thickness burn. Now, when you move to a deep partial thickness burn, you might guess that it now goes deeper into the dermis. So a deep partial thickness burn will be the epidermis, about 2/3 of the dermis layer. And because we're now involving more of the dermis, the sweat glands and the hair follicles are involved because they're contained in the dermis level. All right, and so with this burn depth, you will have severe pain. In fact, this might be the most painful level of burn, and it takes longer than 2 weeks to heal. You may see 3 to 5 weeks in some sources. So healing time is longer. And what do we know again about healing time being longer and that corresponding with scarring potential? It's correlated, right? So scar potential at the level of a deep partial injury is now high for contractures and functional impairment, and the pain will be high. And at this level, you're not only going to see redness, you'll also see whiteness, okay? Not whiteness, white areas. And that white indicates a deeper burn. When you see white on a burn, that indicates a deeper burn and poor blood flow. And with poor blood flow, we have a higher risk of infection, which means that it could potentially turn into a full thickness burn. So while surgical intervention is generally not required for a partial thickness burn, skin graft may be considered depending on the situation and the risk for infection at the level of a deep partial thickness burn. Okay? And I have this cute emoticon of him like crying. You see those tears because it's so painful at this level. All right, and the mechanism of a burn for deep partial thickness, now we're moving from contact with like hot metal to contact with flaming material. So exposure to intense heat to flame, and that's why I have that flame. All right. Okay, now let's move on to a full thickness burn. When we're talking about a full thickness burn, we're talking about the full dermis that is now involved. So where we had a partial thickness with part of the dermis involved, by the time you get to a 3rd degree full thickness, the entire dermis is involved. So epidermis, dermis, and now you have the sweat glands, the hair follicles, as well as the nerve endings. And with 3rd and 4th degree burn, it's important to note that surgical intervention is required. And with both of these 3rd and 4th degree that we're going to talk about, there's not going to be pain. So with 1st and 2nd degree, we talked about a 1st degree being mildly uncomfortable and mildly painful to a partial thickness burn that could be significantly or severely painful. With a 3rd and a 4th degree or full thickness and a subdermal burn, no pain, because there's no sensation, because the nerves are compromised, and because of the depth of the injury of the burn and the skin layers involved, surgical intervention will be required. Okay, so I just wanted to mention that before we get into it more specifically. All right, a full thickness burn. Here, again, we have the epidermis and the full dermis, as well as hair follicles, sweat glands, and the nerve endings. With this one, what you might see is no longer redness, it's now pale, and the skin doesn't blanch with pressure. Okay, and again, there is no sensation, and it'll take months for it to heal. It varies, and the chances for hypertrophic scarring, contractures, it'll be very, very high. Now, I want to go back to no pain and no sensation, that point, to say that although if we're speaking in black-white terms, we can just say that there's no pain, but really in the clinical scenario, in real life, somebody with a full thickness burn coming in will not have all the burn areas be just full thickness. There are peripheral areas that are still going to be at the level of a deep partial thickness, and those areas will still be very painful. So I wrote peripheral pain here with an asterisk, because although the nerve endings are compromised with no sensation at a full thickness level, doesn't mean that they're not going to feel that peripheral pain. Okay? Mechanism of burn. A little more serious now. I put here, there's a chemical bottle, and there's the North Korean leader here with the North Korean flag. And I don't know if you guys remember this story. A while back, his uncle got attacked with either acid or alkali, I'm not sure, but it was some kind of a chemical attack, and the burn was really serious. In fact, he passed on his way to the hospital. I consider not including this in there because who knows? I don't want to be implicated for some crazy law, North Korean law, and disappear one day. If I do disappear and I don't come back, I want you guys to think about this video, make the correlation, and look for me. It would be such a tragic death to die and to be captured due to a YouTube video. Anyway, so that's just the association that I made with a chemical burn, a chemical attack. And the thing with a chemical burn is that it's very dangerous because unless the chemical is neutralized or completely washed off, it continues to seep into your skin. So it can become a really deep, devastating burn. Okay, so as you might guess, the risk for scarring here is very, very high, and surgical intervention will be required. Okay, and that brings us to our final classification for today for this video, which is the subdermal burn. And again, the clue is in the name, subdermal. This is basically a full thickness burn, level of depth, plus the underlying tissues. So you may see your muscle, tendon, fat, and bone exposed with this depth of injury. And a mechanism for a burn of this magnitude would be an electrical burn. So I have a lightning here, an electrical cord, and there will be an entry and exit point with an electrical burn, and depending on its pathway and how it passes through your body, the damage will be significant. It'll affect your organs, it'll affect your brain, it can even affect your eyesight. So a subdermal burn is quite serious, and not only will surgical intervention be necessary, but oftentimes you may need amputation. Here, in terms of clinical presentation, you may see charring at this level, and again, like the full thickness burn, there's no sensation, so you're not feeling pain. And here, I put peripheral nerve damage. There will be significant peripheral nerve damage, and so that's an important one to note here for a subdermal burn. Okay? I think that's it. I hope I didn't miss anything here. All right, you guys. That's it for today. Good luck studying for the rest of your NBCOT exam. I received a lot of letters and messages in the past couple of months saying, Miri, thank you for your videos, and you know, I'd like to request more videos. Many of you guys are requesting videos because you feel like you need these videos to pass, and I'm here to tell you that's not true. No teacher is smarter, no resource guru teacher is smarter than you, and I really actually believe that. I'm not here because I think I'm better or smarter than you. I really hope that through these videos you actually discover and actualize your own greatest potential, and you come to understand how intelligent and capable you are. That's what I wanted most when I was studying for the exam, not necessarily to memorize and cram this information because somebody taught it to me, but for me to develop my own study strategies and habits that allow me to unearth my own potential. I really want that for you. And so as you go through more content today and as you continue to study, remember that there's nothing here that you can't master or problem solve on your own. I'm just showing you yet another mere approach to help you along the way. Okay? So good luck. I'll see you guys again next time when I do the intervention. All right? Bye.